Everybody, one of the themes that seems to be going on since the arrival of and passage of Typhoon Mawar was preparation and then waiting it out and then assessment and then recovery. And it seems now it's also getting involved. And one of the organizations doing that in a very big way is the Todu Guam Foundation, a medical organization that is not only stepping up, but also reaching out. And Lena Rodriguez is one of its leading voices. Lena, Hafide.
Hafide, Jason. Thank you for having us.
Okay, now everybody knows that wonderful facility right there off your left shoulder on your background, but it's a mobile medical facility. So you guys are actually going to go out at the village level and bring services to people, correct?
Right. So yes, correct. So first of all, we did go out yesterday, and so we do want to thank our doctor, volunteers, and nurses, nurse practitioners, pharmacists, and all the med tech volunteers that came along with us yesterday. When the typhoon first happened, we first waited and reached out to all of our staff and our volunteers and made sure everyone was safe and sound. And then we decided, okay, everybody seems to be navigating through this as best as they could. Of course, most without water or power, but a solid roof over our head. And so we gathered together a group of volunteers and we decided to go out yesterday. And so yesterday was our first day out. We decided to go to the 4 shelters. We started with that. And starting tomorrow, we'll be going out to the villages, to the different pockets that we typically service that are not in shelters, but they're also in very substandard conditions. And so we would start with that tomorrow.
Now, what are you seeing, Lena, as far as the nature of the medical services that require your attention right now? Is it break it down for me?
Non-emergent services are what we went out with yesterday, and so we saw a lot of cuts and wounds. That was the number one thing that we saw. Of course, we did see patients with your regular flu, coughs, and colds. And then we also had patients that elevated blood pressures, and a lot of that has to do with, I'm sure, the situation of everything, right? I'm sure a lot of people have irregular elevated blood pressures during this time. And then there were the others, right? Patients on oxygen that just needed a little more, patients that just need sanitary cleaning, because they're in adult diapers or whatever it was. But thankfully, with the team that we had yesterday, we were able to give the services, non-emergent services that were needed at the shelters.
Absolutely. So, ladies and gentlemen, if you are in those areas, blue is the color of our wonderful water, blue is the color of our sky, and blue is also the color of the mobile care clinic. So when you see that rolling into your neighborhood, you know the help is on the way.
Right. Thank you.
Okay. Now you were talking about volunteer medical professionals, and obviously many hands make light work, as is so often said, but you do need people to help you complete your mission. So, what is the call out right now for the types of...
In order to give these services, we do need the help. And so we are always looking for physicians, nurse practitioners, registered nurses, and anybody that can actually just give a helping hand. And if there was one thing that we noticed, right? So we also went out with just our care team, and sometimes they just need a listening ear. And so that was important. And we do a program that focuses on mental health. And we realize we're day 6 after the pandemic, and people in distress, and this goes across the board. You start out and you're saying, okay, we know what we need to do, and we're going to do what we need to do, and you go. But by day 4, day 5, your mental health literally starts to slip if you don't see that ray of hope. And so sometimes they just need somebody to listen to. And so we did have a lot of volunteers that came with us. We have summer interns from last year that came with us and came out and just, give them kindness, give them some kind of hope, let them know someone's listening to them, direct them to the 988 services if they needed further. And so really anybody that is willing to and able to, we welcome them to come along with us.
Okay, and if people, because there may be small pockets of our community, or maybe people that just came to the island recently that are just becoming aware of your organization and the very good work you folks do, how can they reach out to you and get in touch with you if they would like to help as well?
They can reach out to us via Facebook, Instagram, so our social media. Our website is toduguam.com. That's TODU Guam.com. I would say call our offices, but our lines are down right now. But when lines do come up, it's 671-649-8638. But our social media seems to be the most consistent way for people to be able to get a hold of us, because when we do get good services, it comes through.
There you go. Well, Lena, you guys are rolling out again in that wonderful blue vehicle there, but you guys are probably giving the most wonderful and probably the most effective type of medicine there is, and that's hope for our people, and that is an abundant supply.
Thank you. Thank you so much, Jason. I mean, we try to do our best. This is the community that we consistently serve, whether it is a typhoon or not. And so we definitely knew that, there's a lot of organizations in the government as well going out to give the service, but we knew that time is of the essence, right? And so we wanted to make sure we tried to go out as soon as possible. Fortunately, we were able to park our mobile clinic in a hangar, and so it was kept safe, which makes it possible for us to bring the services out immediately. We did have supplies from previous outreaches that were already in stock, so we don't have the delay in waiting for the medical supply companies to open up for us to get the supplies. And so mobilizing the volunteers, and just our staff was something that we were able to do so quickly, and we're grateful for that. And we see that the need just through going through the shelters, and then we did the assessment yesterday on the different pockets that we need to go to. So we will be bringing along the vaccines. We are a VFC site, and so we were fortunate to have a generator that kept our vaccines properly stored during the typhoon. Okay. And so we will be giving those out as well when we go out.
All right. So final question, Lena, before I let you go, because we want to make sure that you guys can go hit the road and continue your mission. But just to maybe alleviate like some of the traffic that's going to be on the roads and maybe to the medical facilities, are you at liberty to say where you're going to be today, now on Tuesday, and at what time?
So we are not out on the roads today, and so because we are going out tomorrow, we have to restock everything that we've used yesterday, and then we put our call out, and so we have our volunteers and physicians that's going to come with us tomorrow. Can I text you our location?
Yes, absolutely. Yeah. And we'll make sure to put that out, because I know that would help like a lot of the medical facilities and
So we're definitely going to be in the pockets of the north area. So between Dededo and Vigo.
All right. Well, Lena, we look forward to seeing you out on the road. And once again, thank you for what you're doing for our island community at a time when we're certainly in need of your services.
Thank you so much too.
All right.